What we've been doing in the last week or so is having a look, and we've had an expert clinical panel review how we capture COVID admissions to hospital. What we realised here in New South Wales that we had a very conservative approach to that capture, and we were back capturing people coming into hospital who, and I think I touched on this a couple of weeks ago, so incidental COVID. Back capturing all the way back 28 days prior to admission, and what that meant was that in our numbers we were getting a skewing of our data. So for example, if you were 22 years of age, you had COVID 3 weeks ago, you recovered from that, fell off your bicycle, broke your arm and came to hospital, we would count you as a COVID admission. After the review by our expert clinical panel, we've now reduced that back capture to 14 days to provide a more realistic picture of what we're seeing in our hospitals, and our numbers reflect that. But on any scenario, whether it's 28 days, 14 days, or whatever the number you use, the trend is the same, and in all cases those numbers are following the same path down. I will also note that in New South Wales that back capture exists. That does not exist in other states, where you would only be counted if you were COVID positive at the time of your admission unless otherwise clinically determined.